Hello, my name is Professor Helen Coleman, and I am a Professor of Cancer Epidemiology here at Queen's University in Belfast. Cancer epidemiology is the study of cancer in the population. So our research applies statistics and analyses data to understand the number of people who are being diagnosed with cancer in a population. We try to improve early diagnosis and detection of cancer, for example, through research into cancer screening programs. And we also try to understand modifiable risk factors such as lifestyle or medication use that could be used to help improve survival in cancer patients, but could also help to prevent cancer from forming in the first place. One of the major themes of our research in Queen's University Belfast is global health and cancer research. This is really important because the majority of the world's population lives in low and middle income countries, and this is where the unfair burden of cancer lies. Individuals who are diagnosed with cancer in these countries are often diagnosed at a later stage and have poorer survival outcomes compared with individuals living in high-income countries. You're going to hear from two of my colleagues about two examples of our global health and cancer research. Dr. Charlene McShane, a lecturer in cancer epidemiology, is going to highlight her work in Mongolia, and Dr. Nguyen Tran, who has just qualified from her PhD, is going to describe her work on breast cancer screening in Vietnam. These are just two examples of really important research which is having a global impact and is being led by our Queen's University researchers. This is so important for World Cancer Day 2022.
My name is Dr. Charlene McShane and I am a lecturer in cancer epidemiology at Queen's University Belfast. Over the last number of years, I and a number of colleagues at the Centre for Public Health have been working with our international partners on a range of projects aimed at reducing global cancer burden. Our research programme in Mongolia actually started from initial discussions with the Northern Ireland ambassador to Mongolia, Mr. Richard Holmes, who happened to be attending an open day at what is now known as the Patrick G. Johnson Centre for Cancer Research at Queen's University Belfast. From these initial discussions, we then held a series of online meetings with our now partners, the National Cancer Centre of Mongolia, and we also took part in an observational visit to Mongolia. Unfortunately, Mongolia has the highest cancer mortality rates in the Asia-Pacific region. Our early collaborative work with our partners and also stakeholders in Mongolia identified cancer prevention and early detection as key areas to focus on in order to tackle Mongolia's cancer burden. Together with our partners in Mongolia, we have committed to developing a research programme that will aim to reduce cancer burden in Mongolia by strengthening the healthcare system, generating evidence to support service and policy development, as well as increasing local research capacity to deliver research.
Hello everyone, I'm Nguyen Tran from the Centre for Public Health, Queen's University Belfast. My PhD project was in the topic of breast cancer screening in Vietnam, amid the context that there is currently no such program in the country. The studies suggest that a breast cancer screening program based on clinical breast examination is highly cost-effective from the perspective of both the patient and the public payers. The current engagement of the women toward clinical breast examination and the absence of socio-demographic disparity in accessing this service suggest a high participation rate when the screening program is implemented. There is rarely one-size-fits-all intervention in public health. Thus, instead of mammography, this study looked at clinical breast examination, an alternative, cheaper screening modality that fits with the context of low and middle-income countries like Vietnam. I hope that, equipped with the evidence from this research, a breast cancer screening program based on clinical breast examination will soon be launched in Vietnam and benefit the Vietnamese people in general and the women in particular.